Hello, I'm Joyce O'Shaughnessy. I'm the Celebrating Women's Chair in Breast Cancer Research at Baylor University Medical Center, Texas Oncology, and U.S. Oncology in Dallas, Texas. At San Antonio 2020, Dr. Joe Sperano provided an oral presentation of a new integrated algorithm for use in our practices for node negative, ER positive, HER2 negative patients to really better understand their long-term prognosis as well as their absolute benefit from chemotherapy. As you know, Dr. Joe Sperano brought us the results of the TAILOR-X trial, and he was the principal investigator looking at pre- and postmenopausal women, node negative with ER positive, HER2 negative breast cancer, who had a recurrence score 25 or under, and who were randomized to receive chemotherapy versus no chemotherapy. If the recurrence score was 11 to 25, they were randomized. And in postmenopausal patients, there was no improvement in their invasive disease-free survival with the addition of chemotherapy to endocrine therapy. However, in premenopausal patients, there was a benefit in invasive disease-free survival with the addition of chemotherapy to endocrine therapy. However, only 13% of the premenopausal patients in TAILOR-X had optimal endocrine therapy with the addition of an LHRH agonist, again raising the strong possibility that the benefit in invasive disease-free survival seen with the addition of chemotherapy in the premenopausal patients was due to ovarian function suppression from chemotherapy. And so we would really like a better tool than recurrence score alone to optimally predict benefit from chemotherapy, as well as to understand the woman's long-term prognosis. And Dr. Joe Sperano and colleagues have put together an algorithm called RSCLin, which is the recurrence score, but in addition, additional standard clinical pathologic features in only node negative patients here now, and putting into the equation the woman's age, the size of her cancer, and the grade of her cancer. And it is a nomogram that we insert the data, and it's on the physician portal of the Genomic Health Now Exact Sciences webpage, and that's how we can access it now. And it's to understand the woman's 10-year risk of distant recurrence, as well as her absolute benefit from chemotherapy. And what Dr. Joe Sperano did is he took the data from the NSABP, B14, the B20, and the TAILOR-X, and modeled the outcome at 10 years and the absolute benefit from chemotherapy. And then he compared the prognostic results showing the outcome in distant recurrence-free survival at 10 years based on the NSABP B14, B20, and TAILOR-X, and compared that to an outside data set, independent, called the CLALIT registry from Israel. And these patients were node negative, ER positive, HER2 negative, had a recurrence score, and had long-term outcome. And they ran the RSCLin score on these patients. And in fact, there was extremely good agreement between the model that Dr. Sperano had done with the NSABP data and the TAILOR-X data, along with the outside independent CLALIT registry database. And so when you utilize this tool, what it shows you are curves based on the patient's exact recurrence score, age, grade, and size of tumor. And you get a very good estimate of the woman's prognosis. That is, what is her chances of remaining distant disease-free at 10 years with endocrine therapy alone? And that's very, very helpful because many of us want to know that with regard to, is it safe for a patient to stop her endocrine therapy at the 5-year mark, the 8-year mark, the 10-year mark? For node negative patients, we don't always go to 10 years, but sometimes we do go to 10 years. It's very helpful to be able to see that prognostic curve based not only on the recurrence score, but on important pathologic variables, tumor size and grade. And then in addition, you will see what the absolute benefit from chemotherapy would be based on the recurrence score, but also on tumor grade, age, and size of the cancer. And this, we would want to know that information at the time of diagnosis. So we would utilize the RSCLin here at diagnosis to be able to give the patient what her absolute benefit in chemotherapy would be with regard to invasive and distant disease-free survival. So a very, very useful tool, and I really welcome it because it integrates both the recurrence score as well as very key variables, age, tumor size, and grade. So this is a validated new tool for node negative ER positive patients. It gives greater precision than using the clinical pathologic data or using genomic data, the recurrence score alone. And it's now available for us to use on its online.genomichealth.com, the physician's portal for the Genomic Health website.